Yeah, good day, everyone. Good day, good day, good day. How are you doing? How's been your day? All right. For those who find it difficult to swallow, which is called dysphagia, there are so many causes. 12th of December is celebrated as World Swallowing Day or World Dysphagia Day. And that's because swallowing is very, very important. Very important. There are different causes for dysphagia. Dysphagia is difficult with swallowing. However, the causes can vary from congenital to acquired, from local to general causes, and it may be within the walls of the oral cavity, pharynx, and esophagus, or maybe within the lumen, or as an extraluminal causes compressing the wall of the pharynx and the esophagus. Basically, any distortion or any change in the normal swallowing mechanism would result in difficulty with swallowing. From the congenital causes, a patient may actually have cleft lip. Cleft lip and palate is one major cause of difficulty in swallowing. Pharyngeal web, pharyngeal cleft, recurrent laryngeal nerve paralysis, oropharyngeal cyst. In our own center, we've seen oropharyngeal cyst as a cause for dysphagia in a 9-year-old child, which was successfully managed. So yes, oropharyngeal cyst, congenital oropharyngeal cyst, is also a cause for dysphagia. The acquired causes varies from infection affecting the oral cavity, the pharynx, the larynx, abscesses within the pharynx, parapharyngeal abscess, peritonsillar abscess, retropharyngeal abscess, Ludwig's angina. All these are causes which are infective in nature. Inflammatory causes may also cause difficulty. Usually these are things like systemic lupus erythematosus, or the other autoimmune condition may also predispose an individual to having dysphagia, which is very, very distressing. Gastroesophageal reflux disease is also another cause. In our center, for adult, gastroesophageal reflux disease is a major cause for dysphagia. It's a major cause of dysphagia. So in females, we've seen Peterson-Brown-Kelly syndrome as a cause for dysphagia, or it may progress to become postcricoid cancers in females. Females are more predisposed to that particular condition. However, by and large, gastroesophageal reflux disease remains a major common cause in adults, in the elderly, in adults, basically. While for children, it's majorly inflammatory, infective causes. For children, the ones we have seen, majorly or mostly, it's tonsillar enlargement, with or without tonsillitis is a commonest cause in children, while for adults, it's gastroesophageal reflux disease. There are neoplastic causes for dysphagia. Importantly, tumors within the oral cavity, within the pharynx, or within the esophagus may predispose or may cause an individual to have difficulty with swallowing. Tonsillar tumor, base of tongue cancers, oropharyngeal cancers, hypopharyngeal or laryngeal cancer can make an individual have difficulty with swallowing. Esophageal cancers, whatever occupies the lumen within the pharynx, larynx, limiting the swallowing mechanism, will cause an individual to have dysphagia. We have also seen neurologic causes as a cause for dysphagia. Neurologic causes from cerebrovascular accidents, any tumors within the brain, space occupying tumors in the brain, can predispose an individual to having dysphagia. Within the problem arising also within the larynx or within the pharynx, cut throat injury, trauma to the pharynx, which damages the nerves, recurrent laryngeal nerve palsy, damage to the glossopharyngeal nerve or the trigeminal nerve, which are the major supplies to the pharynx, and of course the recurrent laryngeal nerves, which supplies the larynx. Cricopharyngeus, palsy of the cricopharyngeus muscle may also predispose an individual to dysphagia. There are external causes, as I said earlier, which can cause compression of the pharynx or esophagus, osteophytes, pharyngeal pouch, tracheostomy tube, of which the cough may actually compress the pharynx, the area within the neck, the esophagus. As the food goes down through the esophagus, the tracheostomy tube may cause discomfort. The cough of the tracheostomy tube may actually cause discomfort and difficulty with swallowing. Other tubes, endotracheal tubes, NG tubes, all these tubes passing through the pharynx into the esophagus can cause dysphagia. Other compression from mediastinal tumor or masses arising within the chest can also cause an individual to have dysphagia. Drugs have also been found and implicated in causing dysphagia. Drugs which cause dryness, especially when the medications are taken with very little water. It may cause dryness within the throat and in the esophagus. Also, very acidic drug can also cause an individual to have dysphagia. Aging, when the elderly lose their tooth, they may have difficulty with the preparatory phase of the bolus, and hence there may be difficulty with swallowing. More so in elderly, we know that the transit time for food is usually very slow, so there is actually prolonged pharyngeal transit time because of aging. The history in those with dysphagia is very important. We take history around what may be the predisposing factors. First, we start from the onset of a symptom, the duration. For children, if a child presents with dysphagia, we're thinking, this is most likely an infective, inflammatory cause or a congenital cause. While in adults, we're thinking of a gastroesophageal reflux disease, we're thinking it could be a malignancy, we're thinking, are there other tissues or structures around the pharynx or the esophagus which may be compressing or limiting movement of the esophagus? So that is also very important. So we take history about the duration of the symptom. We take history about the progression. If it's rapidly progressing, we'll think, could this be an inflammation? Or if it's slowly progressing, thinking, maybe it's a malignancy. If it's the same, it may be a benign condition. We also think about the sex. For women, Plummer-Vinson syndrome, post-cricoid cancer, globus pharyngeus. For men, maybe laryngeal cancer or gastroesophageal reflux disease, as the case may be. The grading for dysphagia is graded into 6. Grade 1, if an individual only complains of dysphagia but still eats, still drinks, no difficulty, no problem. But however, there's dysphagia. That is grade 1. Then also grade 2, if an individual requires liquid to take his or her meal, before the meal goes down, he actually needs to drink water or take liquid to push it down. That's grade 2. Grade 3, even with taking liquid to push it down, still has difficulty swallowing such things like semi-solid. Semi-solid will go, but solid finds it difficult to go. That's grade 3. Grade 4, if it's able to swallow liquid only, but solid may not go. That's grade 4. Grade 5, both liquid and solid. He finds it difficult to swallow it, however, can still swallow his or her saliva. That is grade 5 dysphagia. Grade 6, both saliva patient cannot swallow, liquid solid patient cannot swallow, complete dysphagia. So patient literally drools. Patient literally drools when patient is in grade 6 dysphagia. Patient drools his or her saliva because even saliva patient will not be able to swallow his or her saliva. So we talked about there may be vomiting. There's vomiting, we're thinking of achalasia. We look at, okay, is there pain, is there fever? We're thinking of possibly an infective or inflammatory cause to the dysphagia. If the patient loses weight, this is evidence of cancer. There may not be cancer and the patient still lose weight. For patient who is not eating, patient may lose weight. So we weigh the weight loss with other clinical history to be able to say, okay, this is likely cancerous, or this is likely, or this is not. So, however, there can be weight loss in patients with dysphagia, especially if it's a prolonged complaint. If it's hoarseness, we're thinking it's